Hello there, I am Kyle Bean, and I'm here to talk to you today about skin. Okay, so, as you probably know, our skin is the largest organ in our body. It makes up 16% of our body weight. It helps regulate body temperature by the production of sweat and by the speed of blood flowing through the blood vessels within the skin. In cold conditions, the blood vessels condense to a very small size. This allows the center of the body to heat and preserve the flow of warm blood to the vital organs. Okay, so now that you know a little bit about how our skin is useful to us, let's get started with the structure. Your skin is broken down into three different parts. The outermost portion being the epidermis. This is like the part of the skin that you can see like right here, like the outermost part. The epidermis is made up of mostly squamous epithelial cells. Under that layer are basal cells. Basal cells contain melanocytes, which produces melanin, and melanin helps determine your skin and hair color. We'll talk more about this later, though. The main purpose of the epidermis is to protect the body from the outside environment. The second layer of your skin is the dermis. The dermis provides the epidermis with nutrients. It also contains the skin's blood vessels, hair follicles, nerve endings, lymph vessels, and sweat glands. It consists of strong bundles of fibers that give your skin its firmness and strength. The dermis also contains the skin's tone, like what color it is. The third layer of your skin is called the hypodermis. The hypodermis consists of mostly adipose tissue and is the storage site of most body fat. It serves to fasten the skin to the underlying surface and provides thermal insulation and absorbs shock from impacts to the rest of the skin. So that's all three parts of the skin, so you know what all the skin does now. The skin basically performs a range of different functions, which include physically protecting your bones, muscles, and internal organs. It protects your body from outside diseases, allowing you to feel and react to heat as well. So as you look at the picture here, you can tell that the dermis is in the middle of the big large portion. The epidermis is at the top, and the hypodermis is at the bottom. Now that we know that skin does, there's still something we don't know. How does skin get its color? The biggest contribution to skin color is melanin. Melanin is produced by melanocytes. They're stored in keratinocytes. Keratinocytes are located in the epidermis, like we said earlier. 95% of the epidermis is filled with keratinocytes. The difference in skin color is based on how much melanin that person produces. Every person has the same amount of melanocytes, but the difference in melanin determines the skin color, not the melanocytes. There are two different kinds of melanin, emelanin and pheomelanin. Emelanin is the first kind, and this is found in darker people. If you want to get technical, there's actually two types of emelanin, black and brown. Black emelanin is mostly in non-Europeans and aged Europeans, while brown emelanin is in mostly young Europeans. Pheomelanin is found in people with lighter skin and tends to be more carcinogenic, which is more cancer causing. And this is why people with lighter skin tend to get more skin cancer and other types of cancer. This chart shows all the different skin tones in the world by countries. The lighter the skin tone, the lighter the skin. The darker the skin tone, the darker the skin. As you see in the United States, most everyone in the country has pheomelanin, which is the lighter skin, red hair type people, whereas in Africa you see more eom. People with lighter skin are more susceptible to skin cancer, but everyone can get skin cancer. This leads me to another interesting skin disease. It's called argyria. It is caused by long-term contact or ingestion of silver salts. The most common cause of argyria is a mechanical impregnation of the skin by silver particles, like from silverware or any type of silver, from that kind of thing. There are people today who live with this disease and who are fully capable of living normal lives. There's no physical pain with this disease, but it does turn your skin a blue tintish color, and there's no cure for it, and you have to live with it for the rest of your life. There's a man who lives in eastern Kentucky, and he suffers from this disease. His name is Benjamin Stacy. He was the first in his generation to get this disease, other than his grandmother, who had it 4 generations before him. And he stunned doctors when he was born. No one knew why his skin was blue until one of his grandmothers noticed that his skin looked just like one of her grandmothers. And this is when they realized that argyria was genetic and was passed down to him. Our skin is of high importance, and it could lead to deadly situations if the skin is penetrated, especially for burns. If burns are not treated, it can lead to very serious infection. When you have a deep burn, it normally takes quite a long time for it to heal. So healing the burn is very important. In the past, there would be nothing you could do about this, but now, after an Australian plastic surgeon, Dr. Fiona Wood, created RECELL. RECELL takes cells from another healthy part of the body and puts it in the needed wounded area. The procedure is designed to grab all the other cell types important to heal burns and other injuries. These include fibroblast. Another cell involved is keratinocytes and even melanocytes. This process not only helps the healing go faster, but it helps from scarring to happen. RECELL can also be used when you need anesthesia for a surgery. Another reason to use RECELL is because it is more likely for the skin to be healed properly than getting it treated normally. This new technology is a great way to treat burns, but however, is currently not legal to use in the U.S., even though there had been thousands of patients cured with this process in the United Kingdom, Australia, and Canada. People believe that it will get certified sometime soon, but these types of things take a while to get certified. If you look on the left side of this picture, you will see a bad burn of a young boy's chest. He decided to use RECELL, and in the next picture, you see the same young boy 20 months later. And in the right, that's what the patient normally looks like after this type of surgery. As you can see, the RECELL picture is a lot less scarred. This is why this RECELL process should be allowed to be used.